people coming in. So just a little bit of housekeeping for everyone. I'm Laura Lebec. I'm the network manager for the Working with Dementia Network Plus, and I'm joined today by colleagues from my team. So we have Louise Ritchie and Rachel Carrigan, who are here and who will be helping look after the chat and look after everyone today. So we're very happy to take questions. We'll be trying to keep questions where we can to the end of the presentation, but if anyone has any queries or anything in the meantime, please feel free to use the chat function if you're happy to do that. If you prefer to use the raise hand function on Teams, you can also use that, or if you have a card that you'd like to hold up to say that you'd like to speak, then please feel free to do that. So we'll be looking out for your questions and queries. So we're absolutely delighted to welcome Becca O'Neill-Kerr today, who's going to be telling us more about the Dementia at Work partnership with the Nationwide Building Society. We've got an hour session today. We'll be finishing at 3 o'clock, but we're hoping we'll have plenty of time for questions and queries for either Becca or her colleagues or for ourselves on the Working with Dementia team. So if you're happy, if I can hand over to you, Becca,
Brilliant.
if that's all right.
Yes, absolutely. Thank you. Hi, welcome everybody. Thank you for joining and thank you for the opportunity to talk a little bit about the work we're doing. So I'm just going to share with you some of the work that we've been doing with Nationwide from a Dementia at Work perspective. Just to add, I can't see people on the call, so Laura and Louise, just if there are any questions as I go through, if you could just say that out loud and I can stop. So just to introduce myself, so I'm Becca. I'm a registered mental health nurse by background, and I've worked in the NHS for about 12 years in a variety of different roles, and I've got a particular special interest in safeguarding adults, law practice and policy. And I've also got some lived experience. I lived with and cared for my grandma who had vascular dementia. And I work alongside my colleague here, Gary. Gary has worked as a dementia specialist nurse with over 30 years of experience. And the two of us sort of create the Dementia at Work nationwide team. So for those that may not be aware of what an Admiral Nurse is or what Dementia UK is, I'm just going to do a bit of a brief overview. So Dementia UK is a national charity that offers specialist one-to-one support and expert advice for families living with dementia, and this support is provided by Admiral Nurses. Sometimes people might ask us why we're called Admiral Nurses. So we're named by the family of Joseph Levi. So Joseph had vascular dementia and was known as Admiral Joe because of his love for sailing. When he was diagnosed, his family had difficulty finding the right specialist support. So in 1990, the family decided to set up a charity to develop specialist dementia nurses who could support the whole family. We are called Admiral Nurses in recognition of their father. So the charity receives no funding at all from the government and relies upon donations and our corporate partnerships like Nationwide. And 80% of the charity's income is spent on frontline nurses. All Admiral Nurses are experienced registered nurses with an expertise in dementia care. We now have just over 480 Admiral Nurses currently in the UK. We work in a variety of different settings, so that might be in people's homes, in the community, hospitals, hospices, care homes, local GPs, and we will now have to add building societies to that list. So just would like to quickly introduce a colleague working from Nationwide to just introduce and talk to you a little bit more about the partnership. So Ella, if you'd like to introduce yourself.
Yeah, sure. Thank you so much for having me today. My name's Ella Boxsmith. I am in the social impact team at Nationwide. So at Nationwide, we're guided by a social purpose, and we aim to make our communities better places to live. In 2024, we embarked on a new social impact strategy called Nationwide Fairer Futures, with the aim of helping people who've been dealt an unfair hand in life, focusing on 4 of the biggest issues that we see in the UK society today. Those being youth homelessness, families living in poverty, people impacted by cancer, and the challenges faced by people living with dementia. To make the most impact, we partner with some incredible charities, Centrepoint, Action Children, the Royal Marsden Cancer Charity, and Dementia UK. So each year we give 1% of our pre-tax profits to good causes, and we support our Fairer Futures partners by funding strategic programmes and enabling our customers and colleagues to get involved in fundraising and volunteering activity. And part of our partnership is also something that I look after, which is called business integration. And this is how we take our partnerships to the next level. We offer our expertise, our influence and resource to support the plans of our charities. And we also utilise the skills and expertise of our partners, of the charities, to improve our business practices and better support how we support customers, colleagues, and the communities that we work in. And as you'll hear through this partnership, Dementia at Work is really a shining example of how we take that approach. So we are now in year 2 of a 3-year partnership. During that 3-year period, we are aiming to support 100,000 people living with dementia or their carers through specialist care support and guidance. Our aim is to empower people to have the best life possible. We're doing this through funding 30 new dementia specialist Admiral nurses, and they work in a range of ways. So we have 18 nurses who are providing face-to-face community clinics in around, well, more than, in fact, 200 of our nationwide branches on the high street. And that's for all members of the public. You do not need to be a Nationwide customer in order to attend and book onto one of our branch clinics. We also are funding 10 Admiral nurses on the Dementia UK National Helpline. And we also are funding 2 dedicated Dementia at Work nurses, that's Gary and Becca, who are embedded here at Nationwide for the duration of our partnership.
Brilliant. Thank you, Ella, for that overview of the partnership. So a little bit about Dementia at Work. So here on this slide, you can see the titles in pink. So the bits that are highlighted in pink are our priorities as a team. So these are sort of our overarching aims and priorities that we want to achieve. So we want to support nationwide colleagues. We're doing this by offering free virtual clinic appointments, which I'll talk to you a little bit more about. And we're also working really closely with a variety of different teams, but predominantly working with the HR and wellbeing teams to ensure that employees who are affected by the everyday challenges of dementia have the right access to specialist support. So we're working across the organisation on a wide range of projects, to improve how Nationwide supports vulnerable customers, and specifically those that are living with dementia and their family carers. And lastly, our overarching aim is to look at developing education and resources for colleagues across Nationwide, and this will include things like our new mandatory training for all frontline employees, which I will speak to you a little bit more about as we go through. So just to start off, I just want to talk a little bit about how we set out our priorities and how we've set out the team really, and how we've started to work with Nationwide. So when we first met Nationwide, it was a new relationship, and the team that Ella's working in, the social impact team, and our corporate partnership team within Dementia UK helped identify any key people or key stakeholders or people that needed to be involved. We then invited everyone to a broad steering group meeting to hear all about the different ideas, and we really wanted to see where we could add value. So what we did was we collected all of these ideas into key themes and looked at any areas of overlap to see where we could work really well together. And then jointly, we came up with our priorities that I've just gone through to start working at, and this built our sort of annual plan for the year. So at times we've had to adapt ideas and things have changed. So for example, when we first held the stakeholder group, there was a suggestion of setting up dementia allies or dementia drop-ins across nationwide for colleagues to get access to. But as we've progressed and as we've sort of become more established, this plan changed, and we're now, for example, developing a dementia support community. Another example of this is when we have supported and shadowed different teams across nationwide. One of these teams is known as the Specialist Support Team, and they are a team that quite regularly will be on the telephones and supporting people to bank over the telephones. By spending time with this team, we observed that there were some challenges around frequent callers. So then we were able to support the team with how best to support this. I will go through sort of these in a little bit more detail. So once we identified what our priorities were, we needed to look at our processes, both from a Dementia UK perspective, but also from a nationwide perspective. And using Ella's expertise and having her inside knowledge of the organisation really helped us. Understanding existing processes within nationwide and how colleagues referred to one another was really helpful. So you can see there's an example of one of our posters there. So we really wanted to ensure that our messaging was really clear when we were sort of promoting the service within inside nationwide. So we wanted it to be really clear around how people can access us. So whether that's accessing our support through personal experiences or whether it's for our clinical expertise, or whether that was referring to our team to support with a project. We wanted to make sure that we were accessible. So support for colleagues. So we're supporting colleagues in a variety of different ways, and we are offering virtual colleague clinic appointments. And I will go through these in more detail, but so far we've had 121 appointments booked and 110 people attended. We've been providing a series of webinars and dementia masterclasses through different staff networks, such as the Working Carer Network, and directly to other teams across nationwide. So in total to date, we've delivered 18 webinars with a total reach of 1,051 people attending. Many of these sessions are recorded and staff can have access to them whenever they like, and they can access them through their staff intranet. So topics have included things like getting a diagnosis, after a diagnosis, what's next, dementia and the festive season, carers' well-being and planning for the future. We've also had an opportunity to present to a variety of different teams to help with raising awareness of the service internally throughout nationwide, with an audience numbers roughly over 500 people. We've had opportunities to work with varieties of different services and teams. So for example, there's a National Learning at Work Week which Nationwide take part in, and we were able to host 2 educational webinars as part of Learning at Work. We were able to support with what Nationwide call Walk in Your Shoes events. So these events is when any colleague across Nationwide, they may have lived experience in certain topics, and senior leaders across nationwide want to hear about people's lived experiences. So we were able to support 2 sessions. One was a dementia focused session and another was a sandwich carer focused session. Nationwide has a staff union. So we've been able to deliver webinars to the staff unions, and we've also been able to deliver educational support to Nationwide's occupational health nurses. We've been working with the HR teams, and we've also written content for a dementia wellbeing page, which is hosted on the staff intranet for all colleagues to access. And we are just about to launch a new dementia virtual support community as well, which is very exciting. So the colleague virtual clinics. So as an employee of Nationwide, you can book an appointment with an Admiral Nurse to discuss any topic relating to dementia. So these are free, confidential, virtual, one-to-one clinic appointments which last 45 minutes with an Admiral Nurse, and that would be with myself or with Gary. So these appointments are accessible to colleagues who have any questions about dementia. It could be that the concern is regarding themselves. It could be regarding friends, family members, another colleague, or even a customer. So you don't need to have a diagnosis of dementia to attend an appointment, and they can be accessed during working time. And these are currently being delivered 3 afternoons a week on a Tuesday, Wednesday, and a Thursday afternoon. The reasons for attending these can vary depending on individual circumstances. A person may want to find out about what support is available through their employer and gain a better understanding of balancing work and caring for a person living with dementia, for example. For many people, when they book, it's their first time that they've spoken to an Admiral Nurse and find value in knowing that they'll be listened to and understood. No 2 appointments are the same, and each is tailored and personalised to the individual that's attending. As these are virtual clinics, the person booking can share this link with their family or friend, therefore more than one person may attend the appointment. And there is a wide range of interventions that could be initiated during the appointment, and usually this would include education or maybe further support or information around topics such as psychological and emotional support, relationships and family dynamics, grief, adjustment, loss, communication strategies, care options, local support, dementia in the workplace, information on legal and financial issues, getting a diagnosis, risk identification, carers' well-being of a person living with dementia, and medications. So one of the benefits of working sort of inside Nationwide, if you like, is that me as an Admiral Nurse have direct access to the internal support systems which are in place. So because I've got a really good understanding of what Nationwide can offer their colleagues across the organisation. So when we can really tailor when people are coming to these clinics about what specific support could be offered through the workplace. So this might be signposting to other employee assistant programmes. It could be signposting to Working Carers Network, looking at flexible working policies, looking at things like the carers' passports, for example. So since we've started the clinics, we've had some really great feedback, and I've got some sort of snippets of feedback that I will just share with you now. I will leave these up for a moment for you to read. I think for me, one of the quotes that's really quite inspiring is the one on the top right, where it says, "I've worked for Nationwide for almost 22 years, and meeting the Admiral Nurse is probably the most profoundly impactful conversation I've had at work." So that was very generous and kind of that person to say. But I think here we get a sense of that having the options to talk to an Admiral Nurse, people are feeling listened to, it's helping with any fears, being treated with kindness and empathy, and we're sort of really trying to support Nationwide with this sort of culture and foster this culture of having a person-centered approach, and also to learn more about dementia. So we are also wanting to support how Nationwide supports their vulnerable customers. So we've had the opportunity to be involved and give feedback on a really wide range of projects so far. But this is just to give you a bit of an overview of the types of projects we are working on. So there's 2 main teams which we've established really good working relationships with. So these are the specialist support team, so where it says SST there, That stands for the Specialist Support Team. And this is a team of case managers who support the most vulnerable customers to bank, usually over the telephone. And then the second team we've been working really closely with is the Customer Vulnerability Team. So this is a strategic team that's responsible for ensuring that the correct policies and processes are in place to support customers who may have a vulnerability in some way. So we feed into SST's weekly case reviews. So if they've got any sort of complex concerns about any members, that team is able to have our consultation and advice if they're dementia related, and we meet with them once a week. We also meet with the Customer Vulnerability Team monthly. And SST actually kindly invited us to come and observe them for a week. And I'll talk a little bit about the week we spent with that team. We've helped write a branch familiarisation guide. So this was a guide for anybody that may be accessing a branch for the first time, or maybe might have any anxieties or worries about accessing a branch. So this guide is a sort of a step-by-step what to expect when you go into the branch. We've supported with things like easy read information. We've supported nationwide around their ID and V, so that's how you would identify and verify yourself. So we've given feedback around ways that nationwide could look at those processes, especially if there are challenges around a way a person might identify themselves. We've supported a piece of work around frequent callers, so ensuring that there's a process for monitoring and supporting people that may be ringing the specialist support team frequently, and ensuring the call case managers are asking the right questions and offering the right support to those people that are calling. We've helped written content for a dementia webpage and leaflets. We've fed into projects such as Safe Adult Spending. We've supported with a new business case around carers flags, and also dementia circumstance flags. So if somebody living with dementia was banking with Nationwide and went into branch and disclosed to somebody in the branch that they had dementia, and if they consented to it, Nationwide could keep a record of that to ensure that the right support needs are in place for that individual. And we also kindly represent Nationwide and Dementia UK in this network, which we're really pleased to be a part of. And we also work really closely with our lived experience and advisory panel and seek their input on projects that we are working on. So the week we spent with the specialist support team, so we spent 4 days with this team in person at Nationwide House in Swindon, observing and learning about Nationwide's processes, and we had the opportunity to listen into their telephone calls with customers to see whether we could identify any learning needs or recommendations. We were really warmly welcomed for the week with this team, and it really gave us a better understanding of how the team supports vulnerable members and customers who are affected by dementia, and some of the challenges that the team find. And we were able to then give our feedback to senior colleagues within this team, and we were able to then sort of look at additional work that we can support with. So we gave in total 12 recommendations and piece of feedback to the senior Nationwide colleagues, and these included things like reviewing training content for the whole organisation, which we're really fortunate to have been able to move that forward. I have just popped the link there at the bottom where it says illness and unexpected change Nationwide. So that's the public facing webpage that talks a little bit more about what the specialist support team does. So if anybody on the call today is interested, they can have a look at that. So our last priority that I spoke about was around ensuring colleagues across Nationwide have access to dementia awareness, training. So as previously mentioned, we've been able to deliver 18 webinars with a large impact, which is just excellent. And we have 3 more webinars planned in our diaries for the rest of the year. We've also presented at an immersive event raising awareness, which I've got some pictures of on the next slide. We've also been able to write scenarios for their Mental Capacity Act guidance training. We've held training focus groups with the frontline colleagues to hear about some of their learning gaps. And subsequently from this, we've been able to launch and develop mandatory dementia awareness training, which will be going live, fingers crossed, within sort of the next month, maybe sooner. And so this is a mandatory training that's going to be rolled out to all frontline colleagues across nationwide, which will be roughly 8,500 people. So this includes videos from people with lived experience of both living with dementia and also caring for somebody with dementia. And we've also, and also myself and Gary have been filmed to bring in a clinical expertise to that mandatory training as well. We've collaboratively written an e-learning module, which is a bit more in-depth training specifically for the specialist support team. And the approach for this education is to have a dual approach. So the staff will have independent learning on e-learning, followed up with a facilitated session that will be led by either myself or my colleague, Gary. So some of the in-person events that we've done. So we had a really busy week back in June where we went round and visited all 4 main offices for nationwide. So that was in Bournemouth, Northampton, London and Swindon as part of Dementia UK's flagship fundraising month, Time for a Cuppa. So this event went really well and we had really great engagement and feedback from nationwide colleagues. And during this time, we were able to host face-to-face clinic appointments for colleagues across nationwide, which was really lovely to be able to do. We've also went back for an immersive event where we were celebrating the partnership and collaborating with the branch clinic nurses. So this event we ran 4 times across the day and we had 108 colleagues join us and got involved with the immersive experience, but also had opportunity to have questions and answer sessions with myself and Gary. So we've had some really lovely feedback. So I've just added that onto the screen. And there's a picture of us there with our Britney Spears mics on. To look at what adjustments and support is needed and the usual support that they have. So these things like their occupational health referral for recommendations about assessments and workplace needs assessments would take place on things like assisted technology and coaching strategy. That person's working hours or the patterns of work. In some cases, they may look at redeployment to role. Self and Gary. They might make an appointment with the nationwide dementia Admiral Nurses, so me and Gary. And this could be for the person to have one-to-one, or that could be a group meeting. It's working, so it could be working from home or coming into the office more regularly and looking at well-being and workplace adjustment paths and also support from the HR management team. So the lived experience panel it's a panel that we have within Dementia UK that is made up of people living with dementia or care 5 times a year. So the panel is designed to help achieve benefits for Dementia UK and Admiral nurses. So for me, co-production, ensuring that we're involving people with lived experience into the work we do is essential. And we have been working really closely with this. The voice and supporting people with dementia is heard throughout all the projects that we're doing. So we've been really fortunate to have been able to involve LEAP in projects such as the branch familiarisation project, education that we inside the organisation. So we are evaluating everything that we're doing. This could be via collecting feedback and surveys after contact with the team. So for example, if somebody attended a virtual clinic or attended a webinar, they would have the opportunity to give us feedback about their experience that we're selecting. And I'm very sorry if you can hear my dog barking. So we are collecting feedback on things that we're doing. As this is a new model of nursing for Dementia UK, so it's quite an innovative. So having Admiral nurses fully embedded into an organisation rather than just consulting an organisation is something really new for us. So we're really wanting to look at this in more detail and scope out this nursing model. And as you can see here on the screen, this is some of the achievements that we've achieved within the first year of the partnership. So as you can see, 88% of people received support, so it has made a difference to their ability to take care of the person with dementia. Over 2,400 people have accessed help through the clinics that have been held in the nationwide branches, and just over 29,000 people living with dementia and their carers have been supported by the specialist Dementia UK Admiral nurses, which is really helping us get to our overarching aim of supporting 100,000 people. What is next for us? So what's next is that we're going to be launching the mandatory dementia awareness training, and we are then going to be shortly after launching our bespoke dementia training for the specialist support team, where we've got our blended approach. We're going to be launching our dementia support community, a virtual community that really promotes peer-to-peer support. So and this should be accessible to any of dementia, but we want it to be accessible to anybody. So to ensure that if anybody's got a question or wants to share their experience, that there is a safe launch this week. Communication and sharing we process inside Nationwide. It's a large organisation with 18,000 colleagues, so it's really important that we get to the right people and people know that we're there so they can get the support from us if they need it. And we are going to be working on and continue to working on new and exciting projects that come through. And like I mentioned, we're really keen to create a new model of delivery for Admiral nursing, specifically how we can work inside organisations to become dementia inclusive. And that is the end of my slides. So I will come off that and have opportunities for any questions or any discussions that people may have.